Ah, my people. Oh, you read the title. You understand that things are evolving in the direction of our enemies. The news is not good. The government of the Democratic Republic of Congo, at the heart of the latest smallpox outbreak, plans to begin distributing its initial vaccines starting next week, as scheduled. And although the vaccine has not yet been delivered, the Congolese health minister announced that the United States, coincidentally, committed to providing 50,000 doses, while Japan promised 3.5 million doses as well. Why do I give the impression that this is a bad thing, acting as if the information came just in time, no pun intended? The United States and Japan, who provide gracious aid, confirm even more this theory that it is really pressure from him or his conglomerate, no matter where it comes. Where you might wonder what Japan has to do with the United States or with Bill Gates and his projects, you should know that Japan is one of the best vassals of the United States. Gates wields ample power to control outcomes. To exert this kind of pressure to ensure it goes through Japan, or simply to use his capital and network leverage. Not to mention that Gates is one of the largest donors to the WHO. He indeed has the ability to implement governmental initiatives. So far, everything leads me to believe that this is a perfectly designed scheme to inject into the bodies of our compatriots, into our bodies, because nothing tells us it won't happen. To us, nothing tells us that. And they will inject into our bodies elements that are certainly not for our good, for our health. Will the government of the DRC take the time to analyze the components of these vaccines? I don't know, but it would be good. It would be very good if they did. The guys can take 100 random samples from each batch of vaccines they receive. This is crucial. That means we must understand what is inside and what we are injecting into the populations. At the very least, we must be informed about what we are being injected with. This initiative comes just a few days after Gavi, the Global Alliance for Vaccines, made an announcement. They stated they have a fund of $500 million to deliver vaccines to all the countries that have been affected. The number of smallpox cases continues to rise. The growth is skyrocketing, especially in Central and Eastern Africa, particularly in the DRC. Burundi is also severely affected, along with the Central African Republic, with over 18,900 reported cases and 540 deaths. So 98% of the deaths were recorded solely in the DRC. Health experts have emphasized the crucial importance of an effective distribution of vaccines to curb the spread of the disease in Africa and beyond. It's also interesting to realize that it's only when the disease starts to spread out of Africa that we see people intervene and react. When it was still in Africa, well, it didn't bother anyone. At that time, there was no Gavi, which coincidentally now decides to allocate funds and deploy these funds to deliver vaccines. It's when it starts to become an international issue that people say we should do something about it. Africa CDC's Director General cautioned that the Eastern DRC's vaccine distribution would pose challenges. The area hardest hit by smallpox, more than other regions, would pose challenges to manage. And do you know why? Because there is armed conflict, and this conflict has been ongoing for a very long time. Why hasn't there been an international effort to stop the conflict? Well, who benefits from the conflict continuing besides the population? Dr. Kaseya added that Africa CDC had formed a partnership with the Danish vaccine company called Bavaria Nordic to address the issue, to enable local manufacturing of vaccines and improve accessibility for African producers. This is an interesting initiative. It's even a very, very smart and intelligent initiative. This initiative aims to increase supply and reduce costs because transporting vaccines from one continent to another is very expensive and complex. Whether it is by airplane or by ship, what is the cheapest mode of transport by ship? By the sea route. But despite everything, it costs very, very much. Whereas if it is produced locally, distributing it would be much easier. Controlling it too would be much easier. But for the moment, we do not know at what level the agreement stands with Bavaria Nordic. Producing 10 million doses with a realistic objective, that is what he stated, while urging other nations not to penalize the African people, African countries, in their efforts to contain the epidemic. We remain under heavy pressure, the suffering persists, and the situation is not yet under control. Access to vaccines is likely to be difficult. This was stated by Placide Mbala Kinge Beni, a leading epidemiologist in the Democratic Republic of Congo. Currently, medical care focuses on treating the symptoms of patients with painkillers and antibiotics in case of associated bacterial infection. He also mentioned that the hospitals are overwhelmed, which represents a significant issue since the virus spreads mainly through close contact with infected individuals. And that is where we begin to ask the question, what are our governments in Africa doing to avoid providing us with enough hospitals? What are the governments in Africa doing to avoid providing us with the minimal infrastructure to ensure the population can follow? We are not even yet living. We are not even yet in comfort, just keeping up. That we have the minimum to breathe, to allow us to get through today and reach tomorrow. Why is it so difficult? Why are people so selfish, really? It's exhausting every single time there's a problem. You will realize that the situation is even more complex here because we don't even have the minimal infrastructure. Hospitals are missing, so the infection spreads faster. While on their side, they can travel whenever they want. Go get treated wherever they want, no problem. And those without diplomatic passports, what do? Healthcare workers in Eastern DRC have been experiencing the virus's devastating impact since last year's conclusion. Dr. Jacques Alonda, who provides medical care to patients for an organization that partners with Save the Children in the province of South Kivu, recalls a memorable and striking case. It was a newborn baby who had rashes all over his body. His skin turned black, and he was suffering from a very high fever. His parents were understandably distraught, completely troubled, and didn't even have the means to understand what was happening. Distressed by their child's condition, they feared for his life, which is quite natural. The infection rate among children is extraordinarily high. It's alarming. At the time of the doctor's account, the baby was 6 weeks old and had contracted smallpox at just 2 weeks. Where did the infection occur? Hospital overcrowding affects care quality. The child's mother and the child shared a room with a patient who had not yet been diagnosed at the time and who carried the C virus. This patient transmitted it to the child. Fortunately, in the meantime, we were able to treat the infant and he recovered. But what about all those who do not recover? There are two main variants of the pox virus, clade 1, more severe, and clade 2. Clade 1 causes sporadic outbreaks in the Democratic Republic of the Congo, and it continues to spread even now. Some forms of this variant seem to affect children more significantly than they do adults. On the other hand, there are also emerging concerns about a relatively new and more virulent form of the virus. This is referred to as clade Y, and it appeared a year ago. And that's also what bothers me, because even the way it emerges is troubling. It's spontaneous. Like now it's here. We are talking about a variant that appears. It appeared a year ago. And so it appears. And now they explain that this version has a contagion that affects children much more significantly, which means that children will be the priority for vaccination. Note this information and draw your own conclusions. What do they want to inject into children? Although experts acknowledge that there is still a lot to uncover about clade YB, it might turn out to be even more infectious, more destructive, and significantly more harmful. Last month, 4 countries in East Africa, namely Burundi, Kenya, Rwanda, and Uganda, reported their first case of clade YB, and more recently, it has spread across the continent, because Sweden, Pakistan, and Thailand have also detected their initial case of clade IB smallpox. The symptoms of the illness include fever, headaches, swelling, as well as muscle and back pain. Although 2 recognized vaccines exist for smallpox, these vaccines are currently not available in the DRC or neighboring regions where the disease is endemic, except within the scope of these clinics. Dr. Mbala Kingembeni stated, and I quote, "We are aware that both vaccines provide a good immune response and are safe, but their effectiveness remains to be proven." The Health Minister, Samuel Roger Kamba, expressed hope that the vaccination campaign could commence next week, with a particular emphasis on children. However, it will still require more time to produce and distribute enough doses to meet the demand. That is to say, the more I say these words, the more I worry. The Africa CDC aims to provide 2 million vaccine doses across the continent by the end of the year. Additionally, the Federal Health Minister of Nigeria is set to receive a first batch of 10,000 doses from the United States next week. And last week, if you recall, the WHO declared a global emergency in response to the rapid spread of smallpox. Professor Dimier Ogwana, chairman of the WHO Emergency Committee on Smallpox, warned, reported, and explained that even when resources are available, global vaccine production will not be sufficient to meet all of Africa's needs and requirements. And that's why it would have been relevant if we had laboratories here doing this kind of work, working on it. Because right now, we could produce and distribute in a quicker and more efficient manner. And there, we wouldn't need to wait for other countries to produce for us, while those countries need to serve themselves first. And also to add that the WHO is working with manufacturers to boost vaccine production to meet this challenge, the challenge of vaccinating the largest number of people in Africa. Dr. Maria van Kerkhove, who is in charge of the Unit for Epidemic and Pandemic Preparedness and Prevention at the WHO, reminded that vaccines are just one of the many tools available and must be used alongside strong community involvement in prevention efforts. She also emphasized the need for scientists to better understand the mechanisms of disease spread in different population groups and the underlying reasons in affected countries to better understand the patterns of transmission. She broadly explains that it is crucial to identify at-risk populations because this dynamic is constantly evolving. She said, I quote, "We are observing changes in the epidemiology of the disease. A more thorough understanding of these elements would enable us to utilize the limited vaccine resources we have in a more judicious manner by targeting them optimally." So, that was an update regarding the progress of this matter. We will now continue the video with some current news from Africa. Flooding in Niger, authorities facing a colossal task to restore the Niamey-Dosso road, which was damaged by floods. The Nigerian authorities are literally doing a colossal and monumental job. Unfortunately, the Niger River caused a flood that blocked a portion of the road. This means that the section was no longer accessible. The moment is dramatic, but we are first pleased with what has been achieved so far. This is the case of a guy named Ibrahim Dauda, while the Niamey-Dosso road was cut off at his ear level, and so this road is being restructured. Certainly, seeing this efficiency and responsiveness from the government pleases the population. For those who witnessed the initial hours of the floods, reaching this stage seemed almost unimaginable. However, they finally managed to successfully get to the bridge. Even the village chief was astonished by this development. I told you we have been so accustomed to being disappointed. Seeing African governments actually doing their job is truly pleasing. It is so very pleasing. It is planned that the road will first be opened to pedestrians before allowing vehicle traffic. On the 20th of August, what happened was that the Niger River level reached 647, which roughly corresponds to the red alert threshold. Unfortunately, the toll on that day was also very high. 217 deaths, 200 injured, and 353,287 people who are displaced. It is enormous. These are the figures given by the ANP. Currently, we can only wish them good luck and give them all the necessary strength. All the necessary strength, because it is enormous. From one day to the next, you lose everything. A bit farther on the continent, the East African community postpones its single currency project to 2031. The creation of a currency in East Africa has been delayed until 2031. The member countries of the EAC were divided on the roadmap, and not all met the fundamental macroeconomic prerequisites. This was stated by the EAC Secretary Veronica Mwinyi during the roundtable. The monetary union was to be established in 2024 according to the roadmap. However, this was not achieved and the timeline was thus revised to 2031. This is what she emphasized. There was also an issue with choosing the country that would host the East African Monetary Institute, and there was no broad consensus. Furthermore, some macroeconomic fundamentals are not met by member states, such as the overall inflation rate of 8%, a foreign exchange reserve coverage equivalent to 85 months of imports, a budget deficit ceiling of 3% of GDP, and a gross public debt of 50% of GDP. Alright, now I have a question to ask. Why don't we start with those who already meet the conditions? Why delay a deadline when we can begin working with those who are already here? We can start right now. If it's not a waste of time, then what is it? We all agree that if you want to begin a project and there are 10 of you, but only 4 meet the project's guidelines, you start with the 4 who are ready. We all agree on that. No need to wait until there are 10. Otherwise, it's not even relevant. We start and gradually we will introduce others, because by starting we can quickly identify small errors, little bugs, and others like that, which we correct once before calling everyone else. Why not start once? Anyway, it would have been very interesting to start with those who meet the rules. And to determine the country, we don't worry too much. We draw lots. At least then, it will be done. So, that's what I wanted to share with you in this video. Tell me your thoughts, and we'll meet again next time.